When someone comes to us for help, we really go looking for the reason of why they've sought us out for help. The first step that we take when people come to us is to take a full medical history. The medical history helps us to understand what we need to focus on specifically with each individual. And it also helps us to know if there's another problem that the person might be suffering with that needs to be referred to another healthcare expert. It's not always the case that we're the most appropriate people to help someone with the health concern they're suffering with. If we find out that we are the right people to help this person, then the next step for us is to analyze someone's posture. We may also call this type of analysis a surface anatomical structural analysis. While posture is completely overlooked by most healthcare professionals, it has a huge impact on health, and to ignore it is going to prevent a healthcare provider from seeing a complete picture of what is happening in a person's body. For example, if you have incorrect posture, it can actually increase your chances of morbidity and mortality. In other words, it can cause diseases and can cause early death as well. So we don't want to ignore posture. The next diagnostic tool that we use is to take thermographs and electromyographs, and we do that in all cases of people that present to us for help. These are very accurate ways for us to evaluate what's happening on the inside of the body without any kind of invasive procedure whatsoever. The results of these correlate very strongly with nerve function, which is why we loosely term them as nerve scans. Thermographs and electromyographs have been shown to be an extremely accurate way of finding out where the problem is when someone is suffering with pain. Because of the nature of the problems that we deal with in our centre, we often end up taking x-rays to get an even better understanding of what's going on inside the body and causing a person's problem. While we analyse the raw x-rays just like any other healthcare centre would, we take a couple of extra steps which helps us to be more accurate with our diagnoses. We then take the raw x-ray data and have it analysed by a computer. This helps us to understand the problems that are happening inside the body, affecting the spine and the nerve system, and therefore the rest of the body as well, on a whole different level. It allows us to see things that we could simply miss if we didn't do the computer analysis. Once we've completed the computer analysis, we now have a better idea of where we need to focus our attention. And we go back to the raw data, we super magnify it, and we look at those areas that the computer analysis has told us that we must focus on. It's this attention to detail that makes us different from other healthcare centres, and it allows us to have an extremely high success rate in helping people to get out of the problems that they were suffering with. The good news is that the kind of health concerns that we deal with on a day-to-day basis can actually get better. With the right care, injured tissues are able to repair themselves and remodel back into healthy, pain-free tissue again. For this, we use state-of-the-art manual therapy and photobiomodulation. The success rate of the therapy on average is 88%, which means that 88% of people that come to see us with a health problem get better for that health problem. In addition to that, the therapy is extremely safe and no serious adverse reactions have ever been recorded. For reasons of diagnostic accuracy, therapeutic safety, and a very high success rate with our patients, I truly believe that we have the best healthcare product in the world.